Welcome to Learn Medical Spanish. Today I'll be going over the phrases you could use to do a physical exam or during a physical exam for a patient who was in a car accident, which we would abbreviate MVA or MVC, or had some other kind of trauma. So this will cover a lot of what you might want to tell them during the physical exam. So as usual, this is both a podcast and a YouTube video. So if you're on the YouTube video and you want to subscribe to the podcast, there's a link in the video description, and vice versa. There's a link to the YouTube video in the podcast episode description. It's also similar to a CME course where I go through a bunch of similar dialogues for common complaints in the ER. So you can find that link in the episode description as well. So let's go ahead and get started. This is how it'll work. I'll say the phrases in English first, then I'll give you a chance to think about the translation before I say it in Spanish a couple times. So I'll repeat it twice in Spanish. I'll repeat it once, or in other words, I'll say it twice in Spanish so that you have plenty of chances to repeat it out loud and get some practice. So this is the first phrase. Look at my face. Mire mi cara. Mire mi cara. Follow my finger with your eyes. Siga mi dedo solo con sus ojos. Siga mi dedo solo con sus ojos. Turn your head. And this is for if you wanted to look in their ear and they didn't really have like a cervical spine injury. So just so you could reach their ear more easily. Turn your head. Gire la cabeza. Gire la cabeza. And of course you could add something like to the right or to the left, which would be a la derecha or a la izquierda. Next phrase, open your mouth, bigger. Abra la boca, más grande. Abra la boca, más grande. Two quick notes. Bigger or más grande is in parentheses because you could leave that out potentially. But I find most people don't open their mouth big enough to really see their throat, so often have to add that. And the other note is that usually in Spanish, instead of saying your mouth, you would say the mouth. Or instead of saying your head, you would say the head. When you're talking about body parts, you usually say the. And that's why that's phrased that way in Spanish. Next phrase, stick out your tongue. Saque la lengua. Saque la lengua. Say ah. Diga ah. Diga ah. So of course the ah part is the same, but to tell them to say something, you would say diga, diga. Does it hurt when I press here? So this is a phrase you could use many different times during your trauma exam, potentially, if you need to. Does it hurt when I press here? ¿Le duele cuando presiono aquí? ¿Le duele cuando presiono aquí? Tap here, as in the same thing, but tapping instead of pressing. Tap here. Golpeo aquí. Golpeo aquí. And of course you could say that once, like, ¿le duele cuando presiono aquí? And then you could say aquí, 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 as you continue to press or push or move different body parts to see if it's tender. Does it hurt more when I press here? Now you're comparing two different places. Does it hurt more when I press here? ¿Le duele más cuando presiono aquí? ¿Le duele más cuando presiono aquí? Or here? O aquí? O aquí? Breathe deeply. Respire profundo. Respire profundo. Let it out, as in exhale. 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 Again, as in take another breath. Otra vez. Otra vez. Lay down, please. Acuéstese, por favor. Acuéstese, por favor. Face up. Boca arriba. Boca arriba. You may have noticed that means mouth up, because that's how they say it in Spanish generally. Mouth up instead of face up. Relax your stomach. Afloje el estómago. Afloje el estómago. So you might have thought to say relaje el estómago, which is also correct, but I've just found in real life people understand more easily if you say afloje a body part, to loosen it or just let it go loose, as opposed to relax something. Roll onto your side. Muévase de lado. Muévase de lado. Here's a longer phrase that you might not use very often, but just in case. I need to put my finger in your anus to check for blood. Necesito poner mi dedo en su recto para ver si hay sangre. Necesito poner mi dedo en su recto para ver si hay sangre. Squeeze my fingers. Apriete mis dedos. Apriete mis dedos. Pull me towards you. Jáleme hacia usted. Jáleme hacia usted. Does this feel the same on both sides? ¿Siente igual de los dos lados? ¿Siente igual de los dos lados? push against my hand. And this could be for many different body parts, right? Like with their leg or their arm or their hand. Push against my hand. Empuje mi mano. Empuje mi mano. Lift this leg. Levante esta pierna. Levante esta pierna. Now this one, as in the other leg. Now this one. Ahora esta. Ahora esta. Go like this, as in you're going to demonstrate some sort of motion, any sort of motion. Go like this. Haga así. Haga así. Haga means do or whatever, just to do anything. And así means like this. I need to examine your skin. Necesito examinarle la piel. Necesito examinarle la piel. Please remove your clothing and put this gown on. Por favor, quítese la ropa y póngase esta bata. Por favor, quítese la ropa y póngase esta bata. All right, so that was the last phrase. Hopefully that was helpful. If you want to see the written list of phrases, you can find that on my website. There will be a link in the episode description on YouTube or on your podcast app, depending on where you are. And if you want to find the podcast version or the YouTube version and you're not on that version currently, you can find that link in the description as well. And you can also find a link to the CME course, which goes over a lot of similar videos and similar dialogues. It's geared towards emergency room providers and goes over common chief complaints in the emergency room and different phrases and dialogues that you would use for those chief complaints. So you can find a link to that as well in the episode description. Hope that was helpful, and I'll see you next time on Learn Medical Spanish.